Go.
Are you recording? Hey, this is Michael from Massage Customs, and today I want to talk to you about a technique called active release technique. Specifically, today what we're going to be working on is the subscapularis muscle. This muscle is one that isn't worked on a lot by therapists because it can be pretty painful for the client. And if you don't have the knowledge to work on this muscle, it's going to be uncomfortable and a little scary to work on. So we'll get right into it. The subscapularis muscle sits right on the front of the scapula or the shoulder blade. It attaches there on the medial side and comes out and inserts right here on the shoulder. And it moves the arm when it contracts in this motion. So if that muscle is tight or tense, it can cause a lot of shoulder pain here. But if a therapist doesn't know how to work on it, when they work on the deltoid, when they work on the traps, or they work on the pecs, or any of the other muscles that attach to that shoulder, it's not going to be effective if it's that muscle. So, typically, how they will work on it is they'll just open the shoulder and just dig their fingers in there. That's a mistake because there's a lot of nerves that come out through there, and if you're not careful, you can really put the client in a lot of pain, like I said earlier. So a really effective way of doing that, come over here, is to lift the shoulder up and I palm that shoulder blade. And as I let it down, I just let my thumb fall into the armpit. Here, if I know what I'm feeling for, I can actually feel the nerves and then get off of them. And then I'm going to have the client just raise your arm up above your head. As she does that, I'm going to traction my thumb the opposite direction. I'm not going to put a lot of pressure inward, but really it's just pulling in the opposite way. And I'm going to hold that and allow that to release a little bit. And so as she does that, what I'm doing is, as the stretch gets further, the tension that I'm applying the opposite direction gets stronger. So I'm going to do about 90% of my pressure at the last 10% of the stretch. And that's going to be really effective for breaking up that scar tissue, loosening up that muscle, and freeing up any nerves that might be pinched in there. How's that feel? So working on a subscapularis muscle in this way can be really effective for freeing up that shoulder pain and freeing up some range of motion in the muscle. And the active release technique is probably the best way that I've found to do that.